Welcome to Curitics Conversations, a conversation with leaders who've spent decades building, scaling, and reshaping some of the most complex parts of healthcare. Today, we're going to dive into the intersection of healthcare policy, innovation, and investment, from the realities of leading Medicare and Medicaid programs at the federal level to building companies focused on improving outcomes for vulnerable populations. And today, of course, we are joined by the incomparable Andy Slavitt, co-founder and general partner at Town Hall Ventures. Unmesh, I'll let you add a word before we have Andy introduce himself.
Yes, I am particularly really excited about this episode. We've not had very many guests with such a wide range of experiences. It's going to be a learning experience to talk to Andy about how his investment thesis today is shaped by all the great work he's done in the past with CMS, with policy, with all the other things, and how does it now impact his investment thesis and how he works with the operators on a day-to-day basis and founders.
Yeah.
So welcome, Andy. Excited to have you
Absolutely.
Thank
here.
you, Match. Thank you, John. It's a pleasure to be here.
Thanks, man. We'd love for you to introduce yourself in your own words and just share a little about your background and the work you're focused on today, Andy, if you would.
Yeah, happy to do that. I founded a firm a few years ago called Town Hall Ventures, which, it's a traditional venture capital firm with a untraditional focus. We invest our capital over $1.5 billion assets under management, targeting innovations that occur in underserved communities. Dating back to my time in the Biden White House and dating back to my time running CMS in the Obama administration, clearly saw that the hundreds of millions of people who are on either a fixed income or a low income or who live far from a major medical center, don't have access to primary care, are really the systematic problem in our country that we have to solve, at least in healthcare, and that those problems can be solved, at least in part, by innovation and great founders and entrepreneurs and technologists. So, that's what I've been doing for the last 8 years. Also founded a nonprofit called United States of Care, which is based in Washington, which focuses on policies that expand access and improve health equity. But earlier in my career, I ran an organization as a group executive vice president called Optum in its early years. And before that, I was an entrepreneur and grew up in Chicago area, and had assorted other fun stuff going on in my career, like all the rest of us.
Absolutely. Yeah, I mean, what you guys are doing at Town Hall Ventures was a huge inspiration for me in starting Nightingale back in the day, Andy. And it's just great to see you guys still cranking it out over there. And now with over $1 billion in assets under management, that's an incredible milestone. When you look back across that journey, Andy, what were the experiences that shaped how you think about leadership in healthcare today? You've got one of the most unique backgrounds of anyone we've spoken with, and I think you've got a unique perspective here as well.
I find careers to be a series of chapters as opposed to one overarching arc. And, your careers are influenced by some of the great people you get to work with, and even more so, perhaps, some of the great problems that get thrown in front of you and the great challenges. I remember, I really broke out of the private sector and into the public sector when I led the turnaround of healthcare.gov in the early teens. This is when for those of you who aren't old enough to remember, who are listening to this, healthcare.gov was really the symbolic launch of the ACA, and it failed miserably. And I got to Washington because I made the, I think, quite suspicious decision to call Washington after it crashed and ask the White House if they needed help. And, you make a call like that, you certainly expect it not even going to get returned, let alone that it'll amount to anything. And 3 days after I made that call, they announced that I was going to lead the turnaround of healthcare.gov, which only goes to show you that I was the only person that was foolish enough to make that phone call. Yeah, exactly. The joke was on me, but it was quite an incredible time learned a lot facing off against that problem, which was to fix everything within 5 weeks so that people could get insurance and faith in government programs could be restored. And that was pretty remarkable. similar experience when I went in to lead the COVID response in the Biden White House, and we were really behind the eight ball. There were 5,000 people a day dying from COVID. It's sort of hard to remember that happening, but that was indeed what we were all living through. And we were just on the cusp of getting a vaccine out. In fact, we had a vaccine, had preliminary approval. The problem was they hadn't manufactured enough vaccines and hadn't distributed enough vaccines and didn't have any vaccine sites. So, I think, leadership lessons to me, John, really, I think were about um, uh, galvanizing the group of resources you have together against a problem like this, realizing that, there aren't perfect answers to any question, but you just have to act and you just have to do things and you have to overcome your fears and get out of your own way, which is often the hardest part for leaders. I mean, people tend to think great leaders are made of steel, but it's not the case. My experience with everybody is, we've got these vulnerabilities and you just got to overcome them. And often it's those internal vulnerabilities that are harder to overcome than the problem itself. And, having enough confidence in yourself that you can deliver results, you can mess up, you can fix it, and you can move on.
Absolutely.
Andy,
We just had Sachin Jain from Scan Health Plan on,
Yep.
who I'm sure you know well. Sachin said something that really stuck with me, Andy, that I wanted to bring into our conversation today, which was that he said, the key for leaders is to always truly identify the problem that you're trying to solve before you act. For instance, when you came in as the savior of Obamacare, how did you and your team go about identifying what the problem was in that case? Because it was such a catastrophic launch, or it was a failed launch completely. How did you guys go about analyzing what you were trying to fix when
It's a great
everything was
insight.
broken?
And I'm not going to lie, it was hard because it really presented itself as a technology problem. And yet my instincts told me that technology problems are easily gotten into and easy to solve. It's really the organizational and leadership and cultural problems that are harder. There was just diffused accountability. There was a lot of finger pointing. There was a sort of a slow, more bureaucratic government process at work. And um, I believe that we needed to bring great technologists to bear and put them to work, but ultimately that this was a problem of leadership and management, and um, bringing enough resources and calling the ball and saying, this is the direction we're going to go and we're all going to go there together. That was really half the battle, because, we eventually started to fix the technology, and it wasn't, using any kind of breakthrough, um, you know, technological genius. It was just really operational hard work. And as Sachin said to you, being focused on the challenge at hand. And, fortunately we did that. I think we were blessed with the fact that we didn't have a lot of time, so you couldn't put together fancy plans and outthink the problem and be super smart. We just had to get to work and show results every day and measure results every day. And, I had to do a press conference a couple times a week with, very, very eager reporters and telling them how we were doing. And that's a motivator. Accountability it's uncomfortable sometimes, but it's a high motive.
Yeah, no question.
I want to piggyback on those experiences, Andy. I mean, working at Optum is such a behemoth and leading charge there, to healthcare.gov, to CMS, all these experiences, a lot of character building over time. What do you look at in the founders and operators that you today bet your money on and your fund's money on? What are some of the things that you would see in operators and founders that sort of you take away from years of dealing turnarounds?
Yeah, boy, that's such a great question. And we're just so blessed, as I know you are, John, to work with some amazing founders and entrepreneurs. And I give all of them credit for just even embarking on the journey to begin with. It's such a vulnerable thing to do. It's such a brave thing to do that I respect each and every one of them we meet, even those we don't invest in. I think the really special ones have this sort of magic some would call it an X factor, but I would say, to be more specific, they just won't quit. They're just not going to quit until they're successful. They're going to find a path. We run into roadblocks every day, and on a bad day, those roadblocks can seem like huge mountains, and on a good day, those roadblocks can seem like little tiny speed bumps. And great leaders and great founders and entrepreneurs find a way to be bigger than their obstacles, and to make sure that they can either go around them or go over them. They learn lessons from them. Number two, it's such a truism. I know other people say this, but it's attracting great people who can recruit great people, go a lot further than leaders who are people who are really good at something, but people don't want to follow. And when you meet great leaders and great companies, inevitably, when you meet the 10th, 12th, 14th, 16th person down in the organization, they're all incredible, and they're all inspired, and they're all following tightly. You're great communicators, for sure. I think we have there's so many gifted people, all many of them younger than I am, who I learn from every day, who I think, honestly, Mesh, they bring leadership qualities that I didn't have oftentimes, and I learned from that.
Excellent.
Andy, we almost called this podcast Curitics Confessions, we like to say. And we like to ask our guests to share a war story or a moment when something didn't go as expected or forced a shift in your thinking or leadership. During your time leading CMS or in the White House leading the COVID response, you were navigating two of the most complex periods in modern healthcare policy. Is there a moment from those times that fundamentally changed how you approach leadership or decision making?
It's a great question, and I'm prepared to be as confessional as you'll need me to be, Father. It is Easter period, after all.
Yeah.
There were so many things that didn't go right until they did, and so your mistakes, if you make them well, can often get subsumed by eventual progress. I mean, we had, with the ACA, we had times when we had to practically beg insurers to stay in the market because they were so unconfident in our ability to execute. And we eventually got it done, but we had periods of time when we thought we were going to go into open enrollment without a lot of choices, or without insurers in some markets. And this was a group accountability and a group responsibility. I think what I learned from that is, very rarely should you go in battle with a single weapon and a single where you're single threaded through one solution, because then you're really at the mercy of whomever is on the other end of the phone or the other end of the table when you're asking for help, and that's incredibly uncomfortable. It's always nice to have a backup plan, and so making sure that if there's anything important that's really important enough, that it can't fail, that you got multiple routes at the goal line, that you can execute on, because one of them inevitably isn't going to work. Yeah, I think the other confession I would make, and it's a little outside of the way you asked the question, John, but if I were going to be truly confessional, if I look back, I think there was a period of my life when I was too online, when I was too too present on Twitter, and I think I thought that I was promoting good health and good policy and all of those things, building this platform. But when I look back on it, I feel like I may have been contributing to the noise. There's a lot of social media is people talking to people that agree with them already, and attacking people that don't. And I tried to be 100% positive, but social media rewards you for being quick, and that's not always the same as being productive. And I think it became its own reward. So I went off social media entirely 3 or 4 years ago, and I think it was a good move. I mean, I had 1 million Twitter followers, and I'm not going to lie, that became its own reward, right? Having a platform and an audience
Yeah.
and all that, and
Yeah.
and I think I regret that I didn't pull off sooner.
It's fascinating and a great lesson for life today. Yes, it's
It
gotten
has.
even worse. Yeah. And now, Andy, at Town Hall, a major focus is improving care for the underserved and for complex populations, particularly within Medicaid. From your perspective, where are you seeing the biggest gaps, and how are those translating into investment opportunities today for you?
Yeah, I mean, first of all, as we as investors tend to avoid things we don't personally understand and have experience with. So there's a lot of
Yeah.
people that want to invest in longevity and Aura rings and health apps and function health, and because this is what the investing class I think sees every day. And I just
Yeah.
happen to have been blessed to oversee Medicare and Medicaid and ECA, and got exposure to what life is really like for people who, their biggest problem isn't the Aura ring tells them that their sleep score is a 87. Their biggest problem is
Yeah.
that they can't get access to cancer care or mental health or high quality primary care and have to use the emergency room. And those problems can be systematically attacked and addressed through innovation. And I think that the gaps exist almost everywhere in the system, as we know. I mean, the gaps, even if any one of the three of us were to go experience a healthcare situation today, we'd find plenty of gaps. Imagine those gaps if you're,
Oh, yeah.
dependent on home and community-based services, or dual eligible, or you've got mental health challenges, or you live in rural America and have real access problems. Those are gaps, but they're also, viewed through the right lens, really fun problems for entrepreneurs to solve.
Yeah.
And the really fun problem
Yeah.
for us to back entrepreneurs who have novel ideas on how to solve. And, we've seen, whether it's City Block Health or Unite Us or Landmark Health, or Hopscotch Health, Savita Health, Habitat Health, these are all companies we've invested in over the years, really novel approaches to attacking these problems. And, the challenge isn't whether or not someone can provide a better solution oftentimes, because I think the solutions are so poor in the first place that can be done. Our principal challenge is scaling these businesses. Uh,
Yeah.
Healthcare is littered with small companies, people who do something
Yeah.
for one community or 1,000 people, or but creating something can become a true national model. That's kind of our obsession: is how do we turn these businesses that are hard to begin with into something that are national models. And I'm proud of the entrepreneurs and founders that have been able to do that.
Yeah, it's a rare trait to find in some of these companies, and that the vision, can apply as well to 1 million people as it could to your
Right.
first 1,000 that you with it.
I wanted to quickly jump in on the same ground. So as we guys are building Curitics Health, which is a technology AI platform for value-based care, we tend to fall in the pit of the shiny object, Andy, these days, right? There's all the changes going on with AI and Claude Code. And so our engineering and product keeps running in, more than often running in that direction of finding the shiny object that we can go deploy. But healthcare is a tough sport, as we all know, and only technology doesn't solve problems. It's a combination of people, process, technology, scale, compliance, everything included. When you evaluate companies, how do you identify like what's real and the problem they're solving and the way they're solving it is real and it will scale, like you said, to a national model, versus, they don't really, the folks who are building things are actually going in a different direction. And might still be great founders who need to be course corrected with the right institutional and finance partners and whatnot. But how do you judge the real deal versus all the noise that is happening today with tech?
Yeah, I mean, we tend to invest in, three major things a year. We'll invest in some smaller things, but we tend to and we look at a lot of things and a lot of companies, and there's a lot of great ideas out there that, as you say, when you do due diligence and pressure test them, you don't find necessarily the ingredients for sustainable, durable, clinical, social, financial, operational model. And we tend to shy away from businesses that are direct to consumer, that spend a lot of money to acquire customers. We tend to shy away from businesses that are really don't have an edge that they're bringing to bear, and don't use technology in an innovative way, or data. And we tend to really do our homework on the founding team. Some may have a track record and have done it before, and that makes it easy. Sometimes they haven't, and you really want to get to know them and get to know the people that have worked with them before, and see that they bring these ingredients. Ultimately, there's I'm of the belief, at least, that there's no silver bullets when it comes to healthcare. And so hard work, operationalizing ideas, those are legitimate. And we looked, before we invested in Time Care, which is, I think, the leading value-based oncology model, we looked for 2 years at different cancer ideas and didn't get comfortable with any of them. And we met Robin and the Time Care team, and boom, we were instantly smitten. We looked at school-based mental health for over a year, looked at lots of ideas, and wasn't comfortable with anybody's thesis. And we met, Jake Sussman, was one of the founders of Headway, who was teaching in a public school and had a different approach to provide support for school guidance counselors to provide mental health to kids on Medicaid. And we invested in the course of a couple of days, after looking at this company, after looking around for companies like this for a year. So you got to do your homework and believe you've got the thesis right. We tend to do a lot of thesis work before we look at deals. If someone shows us a company that we have not done a lot of homework in, I think we're foolish to invest, because we don't know. It's not that it can't happen, but we do pride ourselves on trying to do a lot of thesis work first, and then the homework on the company is the fun part, and that means things fall apart. I was just involved in a situation where we spent 4 months with a company that we really liked, and ultimately, for a variety of reasons, decided that they weren't ready, and we weren't ready to invest in them. We built a phenomenal relationship with the team, and I wouldn't be surprised if we come back in a few months' time and take another look and invest again. This is such a relationship business, as everything in life is. There's a lot of art and a lot of science to it.
Yeah, absolutely. Andy, there's been a wave of digital health investment over the past decade. And certainly in this last 2 years, it's all been about AI. I mean, I saw a report that thus far this year, over 70% of all venture capital investment has gone into something AI related. From your vantage point as an investor, what separates the companies that are truly improving outcomes from those that simply add another layer of technology to the system?
Well, let's talk about how we think about AI. In many respects, John, you and I are both around when the internet came to be, and I think people mistakenly for a while thought of the internet as a sort of distinct thing, and you had an internet division in your company that focused on all things internet. And eventually, the internet got integrated into every part of the supply chain, retailing, sales, development. There's not a part of the business that doesn't use the internet. And I think the same is going to be true for AI. And that's in healthcare, whether it's on the clinical side, the operational side, or the financial side, there's infrastructure that can be, used in AI to improve things. And the question is, what are you trying to improve? Are you trying to improve revenue collection, or are you trying to make the healthcare system more productive and care for more people better and more efficiently? And it's usually easy to spot um, from a mile away. Oftentimes, how people are trying to use AI. I think other thing to be watchful for is there's a lot of things that companies do right now that LLMs I think can quite easily do. And so a lot of things that looked really amazing at first when they came out of the box, you can now, shoot, three of us probably could Claude code some of this stuff. And even people like me, are able to develop technology and develop products. And that's really exciting. But it
Yeah.
puts everything on its head, because all the things that we thought were hard, many of them aren't that hard. And so this is coming about at a moment when we're getting true fire data integration and people are getting their data in order. We could see a really productive period in healthcare. And I think that one other thing I think is interesting is, in other technology waves, whether it was internet, mobile, cloud, none of them really moved the needle on improving healthcare productivity, and healthcare was a laggard at adopting these technologies. It's different with AI. Healthcare companies are adopting AI at 3 times the rate of the rest of the economy. So hopefully, again, deployed for good purposes. But certainly, I think we're going to see a boom of good things. And put aside, sitting as an investor, as a consumer of healthcare or as a provider of healthcare, there's lots of opportunities for better tools.
Yeah, absolutely.
Today is a great day to come of age as a founder entrepreneur who wants to solve a specific problem that has long been hanging over people who don't have access to care, because there's new and innovative ways to do this. I'm personally, and I know this is controversial, I'm personally bullish about how AI can be used in mental and behavioral health. Not necessarily as a bot therapist, although I don't think that that's out of the question, that will be quite effective. But we came across a company we invested in called Jiminy Health, which basically transforms the way the care relationship occurs between a therapist and a patient. And it allows the therapist to provide practically 24/7 connection points to their patient, because mental health isn't something that happens 60 minutes a week. It's something that happens all throughout the week, and therapists just have never been able to think of their job more broadly or differently than that. So really exciting. And I think people are just probably scratching the surface.
Yeah, absolutely agree. And Sachin Jain, just, who was one of the first guys to figure out how to monetize healthcare for the homeless. That's exactly the approach he's taken with his street team too. Yeah, absolutely.
So are there any organizations that you've seen that work like the ideal model, when people, process, technology, care delivery, it all comes together well? How does that look like? And do you have some examples of places you've seen where you've seen it work really well at scale?
I think there are different organizations that do different things incredibly well. And I throw some flowers towards Kaiser Permanente. Their clinical and operating model is very efficient and very integrated and very consumer friendly. I think there are organizations like Heritage in Southern California, run by Dick Merkin, who has for a long time really mastered the delivery of high value outcomes for low costs. And slavishly, both of those organizations have in common is they're slavishly operational. Neither one of them, I think, they both are very innovative, but but they both have a massive attention to detail and implementation and execution. So, they're there. And I think, you can name an organization anywhere in the country, and there are things that they do incredibly well. And putting it all together is hard, but it's inspiring. There really is tremendous success. But it goes back to a point we made earlier, Mesh, which is who's done it at scale, who's done it at real scale. And that's where I think Kaiser is impressive, because at least they have some amount of scale, not the kind of scale that I think they've been able to take nationally, but still nonetheless real scale.
Andy, this whole part of the discussion would seem to make an argument for much greater investment in what we refer to as social determinants of health. That if we need to make care more efficient, doesn't it make more sense to go upstream and try to deal with healthcare conditions before they become, big ticket items like an ER admission or an ICU or a nursing home? And yet we see in Medicare and Medicaid, especially, plans going the other direction. There's almost been a disinvestment in these types of holistic supplemental benefits. And in fact, we had Cece Connolly on the other day from the Alliance for Community Health Plans, who said that, if there isn't money, then the plans can't invest in these sort of preventive solutions. And that really struck me as going in the wrong direction, it seems, when the times demand that we go more upstream. Where are you guys in your thinking about this?
Well, I think Cece's point is a good one, particularly if you're arguing for more money in Medicare rates, which is the argument she was making. I'm not sure there's a lot of evidence that supplemental benefits that the plans provide are the answer to addressing the social determinants of health. I mean, if you want to get a real root cause, and you look at what we do differently than other countries, they invest tremendously in the social safety net. We don't. And I don't think that's the job of insurance companies. We have multi-generational poverty that makes people unhealthy, both physically and mentally. That's not easily addressed through when people talk about addressing social determinants. So too often when people talk about social determinants, in my mind, they're talking about, can you get people better transportation? Can you get people healthy food, et cetera, and housing, all of which are really good things. But I think at its fundamental root, we're talking about a cultural difference in our country where, we don't have a culture of prevention. We don't have a culture of community taking care of one another quite to the degree that we should. We don't have a culture of a significant safety net like they do in many countries around the world. I've had conversations with peers from other countries when I was running CMS, and I remember a conversation I had with one of the health ministers, I think from Australia, and it's interesting. Australia's got a very similar culture to the U.S., so it's a nice comparison. And they said, we don't have a perfect healthcare systems, and we don't do everything perfectly well. But the one thing we don't do is we don't leave our citizens in a state of constant fear that if they were going to get sick, they can't afford to take care of themselves. We try to at least cover the basics so people don't have to live with this kind of abject fear. And I think in our country, there's a lot of people that just live in tremendous fear that if someone in their family gets sick, they're not going to be able to afford to access the best medicine. And that's a compact we have decided not to make with our citizens in this country. And I think it's at the root of a lot of the challenges.
Agreed. Well, Andy, thank you so much for joining us and for bringing your perspective to this conversation. And thank you to everyone listening to Curitics Conversations. You can follow us on YouTube, Podbean, Apple Podcasts, and Spotify.
Thank you.
Thank you, Andy. This was I think our listeners would love it. This is for the entrepreneurs, the founders, and also folks who are driving innovation within healthcare organizations.
Pleasure to be with
This
you
is
both.
gold. Thank you.
Appreciate it, Andy. Thanks so much for listening, and we'll see you all next time.